According to the National Institutes of Health (NIH), in the main folks within the U.S. are contaminated with cold sore within the age of 20. Cold sore is typically contracted at a young age, by a kiss from an individual with cold sore or from alternative physical contact, for instance, during a daycare setting, or by sharing razors, towels, and utensils. The Centers for Unwellness Management and Interference (CDC) estimates that within the U.S. a minimum of 45 million folks develop sexually transmitted disease infection, a sexually transmitted unwellness that's most usual in girls. Causes of herpes infections. Here square measure the causes of herpes infections. There square measure 2 viruses which will manufacture what's sometimes known as herpes simplex virus sort 1 HSV-1 and herpes simplex virus sort 2 HSV-2. Usually, cold sore infections or fever blisters within the mouth space, square measure began by herpes simplex 1. Herpes simplex 2 additional usually causes sores within the venereal space genital herpes, whereas herpes simplex 1 is assumed to cause the maximum amount of 30 pc of all first-time sexually transmitted disease episodes. An extra sort, HSV-6, tends to influence infants and may be an element in manufacturing chronic fatigue syndrome. The chance of obtaining sexually transmitted disease rises with sexuality beginning before age 17, a partner diagnosed with venereal HSV infection, a history of sexually transmitted diseases, associated nursing magnified range of sexual partners, HIV infection, and multiple sexual partners. An extra virus within the herpes family is varicella zoster virus, that produces chickenpox. Once chickenpox contamination, the varicella zoster virus hides in nerve cells and should be reactivated later in life to cause what's sometimes referred to as shingles, a painful eruption of blisters on the skin. Epstein-Barr virus, that generates infectious mononucleosis, conjointly belongs to the herpes family. Herpes infection symptoms. Here square measure the symptoms of herpes infection and sexually transmitted disease. Symptoms descend greatly from none to vital painful blisters, flu-like symptoms and with fever and swollen glands within the groin space. Blisters having the contagious virus develop into painful ulcers and deep sores within the buttocks, scrotum, penis, rectum, cervix, or vagina, and should build excretion painful. Humor nodes within the groin will swell. Though, according to the National Institutes of Health, higher than 80 pc of persons within the U.S. who have sexually transmitted disease don't seem to be hit with their infection for the explanation that they need delicate symptoms or no symptoms, and may inadvertently infect sexual partners. In young youngsters, a primary episode of oral HSV could outcome in painful blisters and sores within the mouth on the surface roof of the mouth, and also that gums and humor nodes within the neck will swell. The kid will have a fever and feel unwell, however typically recovers in 7 to 14 days. Though, as in sexually transmitted disease, many persons with cold sore never manufacture symptoms, and also the National Institutes of Health estimates that solely 20 to 40 pc of persons with cold sore have repeated outbreaks as adults. The common sign may be a single blister or cluster of blisters on the mouth or lips, however they will occur on the nose, cheeks, or chin. A genital infection could happen as a crack or cracked lips or may be mistaken for a bud bite. There may be tingling or pain within the space before the sore breaks out, throughout which period the virus is already spreadable. Once blisters type, they crust over and may become unquiet as they heal. They often recur within the same location. The four most obvious symptoms of herpes infection square measure typically found in persons who have solely recently been infected as a result of they are doing not still have associated nursing reaction to the virus. In regular episodes that body's reaction identifies the virus and reacts to that, therefore the symptoms square measure typically abundant milder. Herpes infections treatment. Here is that the treatment of herpes infections, a clinical examination is also useful if a typical eruption with blisters is gift, however this is often not typically the case. Also, alternative sexually transmitted infections manufacture sores within the venereal space which will look alike to herpes sores. Infectious agent cultures, during which a swab is taken from a blister or sore and a culture is full-grown during the laboratory to visualize the virus, dwindle sensitive because the sores heal, however if penny they will differentiate between herpes simplex 1 and herpes simplex 2. Special blood tests could live the existence of the various HSV antibodies that type within the first few weeks once the primary infection, which can be helpful, in the main if the infectious agent culture was taken too late and is negative. Whereas the majority herpes simplex 2 is sexually transmitted, a positive herpes simplex 2 protein biopsy powerfully indicates a venereal infection. Even if around 30% of all new venereal outbreaks may be owing to herpes simplex 1, regular episodes of sexually transmitted disease square measure additional doubtless to be due to herpes simplex 2. There's no heal for herpes. Cold sores typically heal while not treatment in 7 to 10 days. Special medications, referred to as antivirals, could scale back the time of a pandemic of sexually transmitted disease. When antiviral medication is consumed to prevent frequent outbreaks, the treatment is thought as restrictive medical care. While this doesn't kill the virus or modification the frequency or severity of outbreaks once the medication is stopped. Victimization special delicate soaps to the infected space to keep clean, or victimization ice or heat, will scale back pain. Rarely, herpes infections is also vital enough to want hospitalization. Herpes may be a common and spreadable infection. Interference may be laborious, particularly as a result of most persons with herpes simplex 1 and HSV 2 square measure unaware that they're infected, and, even for those persons who square measure aware, there may be periods of shading even once they don't have any symptoms. The sure thanks to forced all sexual transmission of sexually transmitted disease is to abstain from sex, or to be engaged in during an associated nursing exceedingly in a very long metagenic relationship with an antiseptic partner. Persons with outbreaks or symptoms shouldn't have interaction in sex with antiseptic partners. Condoms don't forever cowl the venereal areas which will be contaminated or areas that harbor the infection, so that they cannot stop transmission, even if correct and consistent use. Daily restrictive antiviral medication could assist scale back transmission to sexual partners.